Dr. Len Friedland is a vaccine scientist.
What exactly is injected into a patient?
What's injected into the patient is what we refer to as the antigens. The antigens are the proteins that the body sees and says, aha, that is something I need to make my own immune response to.
Dr. Friedland says that prepares the body to respond more readily when it actually encounters the flu virus.
Vaccines save more than 9 million lives each year, even though they contain ingredients that can be pretty dangerous. But that's precisely the point. Those nasty ingredients are the only reason that vaccines work at all. On their own, our bodies are already pretty good at fighting off illness. When an unfamiliar pathogen invades our body, patrolling immune cells engulf a few of these foes to gather intel. The cells then churn out a chemical alarm, transmitting the enemy's information along the chains of command and triggering the production of specially targeted antibodies and assassin cells to fend off the rest of the invaders.
Hi, I'm Sarah from Home Air Check. Today we're going to discuss formaldehyde. What is it? Where does it come from? Why is it dangerous? And lastly, how can you reduce your family's exposure to formaldehyde in your home? Formaldehyde is a colorless, strong-smelling chemical that is used in many common products. At room temperature, formaldehyde vaporizes out of the product and into your home's air. This is called off-gassing. One of the primary uses of formaldehyde is in building materials, like pressed wood products, such as particle board and plywood, engineered flooring, insulation, furniture, paints, adhesives, and floor finishes.
First up is formaldehyde, a molecule best known for preserving dead things like animals in jars or even human corpses. Formaldehyde is great at this because it locks a bunch of cellular components together in a process called fixation, which stops any chemical reactions and makes tissues more rigid. This slows down any decomposition and kills off stray bacteria. Formaldehyde solutions are so good at preserving dead bodies that funeral directors keep using it, even though it's known to cause cancer after prolonged exposure.
That does require introducing a bit of the enemy into our bodies, but it's an enemy that we've already disarmed, either by killing it, breeding a super weak strain, or dismembering it to get at recognizable, but not dangerous, parts. Enter formaldehyde. It's a critical ingredient in some common vaccines, like those for tetanus and influenza, because it alters the structure of those pathogens just enough to render them harmless. This reactivity also makes formaldehyde dangerous to us in large doses, but vaccines contain only a tiny fraction of the formaldehyde we consume in food and naturally produce in our bodies on a daily basis. In fact, the biggest risk with formaldehyde is that it can leave pathogens so crippled that they won't trigger the proper immune response.
Formaldehyde is a combustion byproduct and can be found in some cosmetics, textiles, and hair care products. How is it harmful? Symptoms of formaldehyde exposure can be difficult to identify because they are similar to common cold and flu symptoms.
Symptoms of formaldehyde exposure can be difficult to identify because they are similar to common cold
and flu symptoms. Studies show that when formaldehyde levels exceed 100 parts per billion, some individuals may experience adverse health effects, such as watery eyes, burning sensation in the eyes, nose, and throat, coughing, wheezing, nausea, and skin irritation. Emerging evidence shows that formaldehyde can lead to the development of asthma in children. It is also a known cancer-causing agent, or carcinogen.
So some vaccines contain substances called adjuvants, which put the immune system on higher alert. Aluminum, for example, causes a minor irritation at the injection site, summoning immune cells to the scene so they'll encounter the weakened enemy.
As aluminum is also making people sick in other ways, through the very products that make life more convenient and safer for so many.
I was surprised when I found it, for example, in vaccines, or when I found it in certain kinds of cosmetics, in antiperspirants, even in foods.
Scientists in the film link aluminum found in those products to a wide variety of modern diseases, including breast cancer, Alzheimer's, allergies, and autism.
A loss of motor function included loss of motor neurons.
Neuroscientist Dr. Christopher Shaw is particularly concerned about the link between aluminum, which can be found in drinking water and antacid medication, and Alzheimer's, a fatal brain-wasting disease.
And many researchers are beginning to accept that aluminum has some sort of role to play in neurodegenerative diseases such as Alzheimer's. Whether it does in others is still an open question.
And although too much aluminum can be toxic, our bodies are super efficient at eliminating it, keeping levels low even after lots of shots. So while boatloads of aluminum, buckets of formaldehyde, and an up-close meet and greet with a full-strength pathogen are all definitely bad ideas, a controlled concoction from a doctor is designed to be just nasty enough to keep us safe.
So aluminum is really a threat for mankind, and we don't have enough research, and that's one of the reasons why I made this film, to give support to the scientists who want to do more research, and I think it's really necessary.
All around the world, there are laboratories that are constantly taking samples from people's nose when they have something that looks like a cold, something that looks like the flu.
Those labs identify which strains are causing sickness that particular year. The labs share the data with the World Health Organization.
Practitioners, doctors, nurses, community workers working with communities to detect cases at community level. And the most likely person to become a case is someone who's been a significant contact of another case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
Look back over the past several days, you see there's a certain continuity to that number. Again, that's the one number that I look forward to seeing drop as soon as I open my eyes in the morning. And it has been flattening, but flattening at a terribly high level. Again, to put it in context, 9,385 lives lost when you add those from yesterday. Put in the context of 9/11, which was supposed to be the tragedy of my lifetime, 2,753 lives lost. We're now at 9,000. For corrective action and expenses on handling the virus. Kaiser Health, which is a very notable organization, said that Nebraska, Montana, for example, Minnesota, are getting approximately $300,000 per COVID-19 case.
Are getting approximately $300,000 per COVID-19 case.
New York State gets approximately $12,000. How can that be? It can be because in the Senate, it became a game of political pork, and I want my share as opposed to where is the need genuinely. And New York is vital to this American economy. It's not just about New York. Our economy is vital to this country. You want New York's economy up and running, not just for the good of New York, but for the good of the nation.
I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor.
That if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that. Dies with COVID-19, we are counting that as a COVID-19 death. Counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?